Hi there, I'm Prue, one of the vets at Thornley Vet Hospital, and today we're going to show you some of the processes involved in doing a dental on one of our patients. This is the beautiful Toffee. So we are doing a low-grade dental on her today, just to scale and polish. And the first thing we do when we get them in is give them a once-over. We listen to their chest, we take some vitals, we make sure we're not missing anything else. We also pull bloods on all our dental patients if possible. A pre-anaesthetic blood panel is a great idea to check how everything's functioning, make sure no problems come up that would suggest we shouldn't do an anaesthetic on them. So Toffee has already had her bloods and she got a full tick of approval. So we're going to proceed with her dental today. Once we've taken the bloods, the next step is all our patients get a pre-medication. And this is basically used to keep them calm and to provide some pain relief as well. So it's given about an hour before we start the procedure. We are all about fear-free here. Now, Toffee loves everyone, so she's a really good patient to demonstrate on, but it's always good for us to have a second set of hands to distract and cuddle and kiss while we're giving injections and doing something that's not very nice. So Nick here is going to hold while I give her her injection. And the beautiful patient that she is, she didn't even notice. So we're going to let that kick in. Whilst we do that, our nurses set up our dental prep area, which is this table. So really important things for our dental prep is we set up a lot of heat protection for these guys. We get heat mats. We have a bear hugger, which is basically a hot air filled blanket that goes over them whilst they're under anaesthetic, because we know any anaesthetic drops their body temperature. So that keeps them nice and snug while they're under anaesthetic. We set up all our dental equipment. We've got our charts on the wall ready for doing our check once they're knocked out. So the next step will be putting a port in Toffee and getting her fluids ready for her anaesthetic. Okay, so we've given Toffee some time for her pre-medication to take effect, and the next step is we're going to put an IV port in her leg. This gives us really quick access to give her drugs, particularly if we needed it in an emergency situation. And also all our dentals get intravenous fluids provided throughout the procedure. Really good way to maintain blood pressure and just provides them with a little bit of extra support whilst they're knocked out.
In this series of photos, you can see us placing an IV port in Toffee's left front leg and then providing her with oxygen via a mask for 5 minutes prior to the procedure. She is then placed under anaesthetic via administration of an IV induction drug. Once she is asleep, a tube is placed in her windpipe to allow us to provide further anaesthetic and oxygen whilst protecting her airways during the dental procedure.
Okay, so Toffee's now under anaesthetic and Nick's just getting us sorted with her monitoring equipment, and while she's doing that I'm going to perform a dental exam on every single tooth. So the first thing I do is look at all of her teeth and just make sure they're all in the right place, everything looks okay. And then I take a probe and I literally move my probe around the edge of each tooth to check that there's no pockets there, and I do that on the inside and the outside.
Once I am satisfied I have examined and recorded the health of each tooth, we proceed to dental x-rays. We recommend dental x-rays for all our dental patients and think it's particularly crucial for those with grade 2 or above dental disease, as we often find disease that we would otherwise not know was present, such as broken retained roots, tooth root abscesses, or reabsorptive lesions. Throughout this process, my vet nurse Nikki is carefully monitoring Toffee to ensure her anaesthetic is going smoothly. This includes regular checking of blood pressure, heart rate, breathing rate, temperature and anaesthetic depth, whilst ensuring her IV fluids are running and she is provided with active heating via a bear hugger and heat mats. Following dental x-ray and the dental exam, we determine if any teeth need extracting. This involves administration of a local anaesthetic and removal of each tooth in much the same way a human dentist would complete this. Thankfully, Toffee does not require any extractions, so we proceed to her scale and polish. This process is exactly the same as the scale and polish you would receive at your dentist. Each tooth is scaled on all surfaces to remove plaque and tartar and then polished. Her mouth is then flushed out with water or an antiseptic wash. Whilst I am finishing up the dental, Nikki is checking Toffee over to make sure she doesn't need any other procedures performed, and we haven't missed any additional concerns such as skin disease or small lumps. In Toffee's case, we took the opportunity to clip her nails and clean out her ears. Once the procedure is complete and the anaesthetic is turned off, Nikki manages the recovery process whilst I complete my dental report.
Alright, now Toffee's dental procedure's all done, so it's really important now that we just monitor her until she's up and awake and walking around. It's really important that we keep her warm and keep a close eye on her while she's recovering.
Once the patient is able to stand up, they are taken outside for a toilet break and their IV port is removed. Pain relief may be topped up over the afternoon if extractions were required. A discharge appointment is booked and they are ready to go home.